Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. My name is Paul Thomas in the studio today, as always on a Wednesday. Catch my breath, Bill Kearney of Northlake Medical Pharmacies.
Yeah, we're hurrying around today to get right on time with this new format. So
Yeah.
I just had a call to the Board of Pharmacy on my way in, and I kept thinking, I don't know whether I'm going to make it right at 10 o'clock or not. And so luckily I had passed a sheriff going the other direction and made it in okay. But good to be here. It's getting ready for another storm, it looks like.
Yeah, we got one rolling in tomorrow. So
I have to, I don't have to, I'm going up to Eureka to walk in a walkathon for autism for my grandson, and it's supposed to rain all day. But happy to do that, and the Rotary Club of Lakeport was very willing to donate a considerable amount to this cause, and we're taking that money from Lake County to an autism group in Humboldt County, and looking forward to helping out that organization. When you have somebody that's autistic, it's quite a challenge for the parents as well as the school system, and we need a lot more support as the group of autistic kids have grown considerably. I had downloaded an article, and obviously in my rush to get here I didn't bring it, and it was about a 45-year-old gal that was diagnosed with autism later in her life, and how important it was for her to realize that there wasn't really anything wrong with her other than being autistic. She knew she was more intelligent than a lot of other people and had a lot of skills that other people didn't have, but her social skills weren't part of that increase in, and so she had a lot of problems going through the educational system, and we forget about those kind of things before. And my son had already raised a daughter, and then they decided they would have another family because she had been an only child and had one child, and which was autistic, and they didn't know that at the time. And then the second child they raised to have someone for the first child to grow up with, and in the interim found out that that his child that he had after his daughter was raised was autistic, and it's become quite a challenge. He's a brilliant kid. Love to take him to the casino with me sometime and help me out a little bit, because great numbers kid, and so we're trying to focus on autism and really bring some of the highlights to autistic kids, and hoping the educational system accepts part of that, and we have some good things in order to help that part of the community in the future. You know, I've talked a lot about why do I do these things that have maybe unfavorable results in many times. And when I did this thing about this adult woman that had autism, she has become a successful journalist and author, and she's a wife and a mother to 4 adult children, and she loves cats, and she loves writing, and she's eloquent and quick-witted, but she wasn't diagnosed until 2015 at 47 years old. And she had a rare connective tissue disorder that returned her to the hospital exhausted many times, hoping to find out what was wrong with her. And she had an explosive meltdown, and one that was not unusual for that condition, but she just assumed that she was muddling up with another patient, and it ends up the nurse, half smiling, knew what she was going through, and she got to some traits of girls with autism, and it was just like hers. And she had never thought about that ever, because she grew up without being diagnosed. They're about 4.5 times more common in boys than in girls, and of course they don't do the research on females as they do on males because there's so many more boys than girls getting it. But not everyone is convinced that really reflects reality. There's now lots of studies that cast doubt on the gender ratios. In 2012, the United Kingdom, which is in England, found that only 8% of the girls with Asperger's syndrome, which is a high-functioning form of autism, were diagnosed before they were age 6, compared to 25% of the boys. So those girls and women often struggle for many years, and there's a highly likelihood of misdiagnosis. And she was misdiagnosed several times. Her childhood doctor was convinced that she had an eating disorder, and she was misdiagnosed with hyperventilation syndrome and eating problems and anxiety. And kind of the reason the girls aren't diagnosed is because sensory issues were and still are a big problem. That means if there was a label that rubbed on her clothes or sock seams, or if she didn't want to eat, she would really melt down, and her meltdowns were so extreme she could hold her breath until she passed out. My grandson, in his condition, he tries to memorize everything that goes on in the room. And when there's just his family circle, he does just fine. When he's in school or when he's at a Christmas function or a family reunion type situation, he's what we call stems out because he can't possibly remember everything that's going on in his life. So those are the same difficulties that boys and girls both eternalize and don't say anything about it many times, but that's why we need to do a lot more research, and especially with females as well as males. She has 2 younger children, and she looked for a high-profile autistic woman who could relate to her, and found Temple Grandin, who's one of the famous females that has written many books. And although many people are supportive of the diagnosis, they don't know what to do to make it better, and so they're kind of ignored. So I just wanted to focus on this, and I don't even know if this is National Autism Week or whatever. I assume it is. We're going up there with, Dana has made 12 baskets for them to auction off in Eureka for a fundraiser. And hopefully it will be a good weekend. I don't mind walking in the rain. I don't mind doing anything that I can for somebody that's less fortunate than I am. So, I talked a lot about in the last couple of weeks about me talking to you about not taking as many drugs. So we're going to talk about a little bit about who really needs cholesterol and blood pressure drugs, and then we're going to talk, and I saw this online last night, and I thought, these are pretty basic things, but as I started to print them out, they're pretty basic, but do we ever give a real answer to that? So later on in the show, we're going to talk about questions that you should ask before taking prescription medications. And although it isn't only prescription medications, it can be over-the-counter things like we talked about a few times about people overdosing on. So before we get into that, we're going to finish what I was doing the other day and talk about some of the important things that were changing as far as the field of medicine. And one of them that we've not talked about for a while is restless leg syndrome. There's about 1 in 40 Americans that really have RLS, or restless leg syndrome, and it's an uncomfortable urge to move the legs or arm while at rest. My wife doesn't like me to talk about her, but she's had this condition for some time, and it's very painful to watch at night while she's sleeping. She has these involuntary moves that you think it must be impossible for her to sleep at night. And she has another condition that's a lot more dangerous called CMT, Charcot-Marie-Tooth, and a combination of these two makes it very difficult sometimes to sleep. There's no really known cause for the restless leg syndrome. It may be linked to iron deficiency, pregnancy, renal disease. Most people will test negative in all of those things. Sometimes leg massages or stresses for acute relief. Last night it happened to be a hot bath. We had gone in the hot tub earlier, and she felt better with her back, which is the other problem. And but when she went to sleep last night, the restless legs just got out of hand, and so she went into a hot tub, and I put some hot towels around her, and it relieved a lot of that. So there's a lot of meds that you can try for severe symptoms that interfere with sleep or daytime functioning. Gabapentin is one of those. Pramexapro, Mirapex is another one. Decreases the urge to move limbs, but after you've been on them for some sort of time, that ability for those to function as well as they did disappears. They build up a resistance to the medication, just like we do with antibiotics and things. Those meds have similar efficacy. About 1 in 5 patients have at least a 50% drop in symptoms in the beginning, and is eventually decreased. So. And a lot of those drugs like Raniprol or Pramexapro at the lowest effective dose are effective, but they cost more, and eventually you have to keep raising the dose. If augmentation works, which is using a couple of different drugs together, we suggest trying that gabapentin, which causes some people to have a memory loss. But usually it takes some time to titrate to where they need to get to where it's really effective. And I know people have a tendency to want to rely on benzodiazepines like Ativan or Xanax because they're anxiety medications, but they don't have enough evidence of benefit to concern yourself with actually the risk of being addicted, because we talked some about those being drugs that eventually cause an addiction, probable. So we need to be very careful about that. A lot of patients will ask about Miralax, which is one of those drugs that either causes diarrhea or will help in constipation. But there's been some recent literature out about it affecting children, about some neuropsychiatric effects, and that's based on a number of tics, like people have aggression, anxiety, using these drugs for constipation. There isn't any real proof that that works, and I'm not trying to embed that into your memory because there isn't a lot of clinical evidence to support. In the past, we've tried to give you all kinds of information about what may cause a problem, and this was in the press recently, and it's not very well founded by clinical evidence. The concern's coming up to the lay press because those products can contain small amounts of ethylene glycol, which is the product that's used in antifreeze. Now the FDA is funding a study to see if kids using those products chronically absorb metabolites or smaller molecules such as ethylene glycol. Pediatric guidelines still recommend the Miralax, and there's good evidence that short and long-term use is safe in kids. The first thing, as we would in adults, is encourage adequate water and fiber, and up to 1 cup per day of fruit juice, such as apple, pear, or prune juice. If it's recommending for starting, the doctor's starting with that laxative, Miralax, lactulose, or possibly magnesium hydroxide. So very less expensive and maybe just as effective. You're going to see people, if the current standard of practice conforms to what's going on in the national community, on people stepping down in asthma meds, especially adults. A lot of people that have been diagnosed with asthma may not really have it any longer. And as people age, sometimes the active disease disappears. So if you're well controlled for at least 3 months, a lot of the pulmonologists are suggesting, if their lung tests are normal, to start stepping down off their medications. It may not be a good idea for others, such as patients with one or more severe breathing problems in the last year, but those with intermittent symptoms due to allergies or other triggers may be a candidate to take less of these meds. In most cases, recommending stepping down asthma meds in the opposite order of how they were added, and you use these general guidelines. So for adults on long-acting beta agonist combo inhalers like Advair, perhaps dropping to a lower strength and then switching to a rescue inhaler or an inhaled steroid alone, which you can buy over the counter these days. The next step would be reducing that inhaled steroid dose by about 25 to 50% every few weeks to months. For example, patients may drop to a lower strength steroid inhaler and then use half the daily puffs, then stop. Now, I'm not advising you to do this. I'm just telling you what the pulmonologists are looking at now, probably because the threat, a steroid combination and beta agonist inhaler now costs $350. There's a lot of cost to maintaining steroid medications, especially inhalant medications, and there's a lot of side effects with steroid therapy with oral dexamethasone or prednisone or methylprednisolone. So if patients do step down, make sure that they have the controller meds and a short-acting inhaler like albuterol, which is a rescue inhaler, and an asthma plan for when and how to restart the treatment. So that's something you and your physician need to talk about. If you're comfortable the way you are and you don't have any plans on stepping down on medications and you're still having 3 or 4 more episodes, breathing episodes a year, then such as wheezing or tight chests or pneumonia or bronchitis, be very, very careful. So don't stop using that medication, and if you do, do it with your physician's consent, and don't reduce the use of those steroid inhalers by more than 25% to start with, and eventually maybe 50%, but only do it with a pulmonologist or your internal medicine telling you to that it's okay to start a reduction plan in the medication. The Center for Disease Control and other agencies are leaning heavily on pharmacies to prevent falls in elderly patients. 1 in 4 people that are like 65 years or older will fall every year, leading to about 7 million injuries and over 27,000 deaths. Just speaking about people 65 years and older, I want to mention something in case I run out of time. Partnership Health, which is the Medi-Cal agent in Lake County, will pay for the shingles vaccine for you if you're between the ages of 50 and 64 and a half. So they used to say not before the age of 60. Now they say 50 to 64 and a half. So if you're on Partnership Health and you are over the age of 50 and under the age of 65, you can get a $225 cost shingles shot at no cost to you at the pharmacy. You don't have to get a prescription. We provide the prescription for you. And we were just told this by the Merck representative who makes Zostavax this past week. We had never heard about that before. So I just want to remind you, in going off on another tangent here, about geriatrics, that there are some advantages before you get 65 when it comes to getting an immunization for a Zostavax for shingles. You know, people, when they start to fall, back to the topic, they think that falling is a normal part of aging, and I question. The health profession says it isn't, but as you get weaker and have less weight-bearing things going on, and take more medications, your risk of falling becomes more. And also checking blood pressure before and after people stand up to identify whether they have orthostatic hypotension. And a lot of people get on a drug that they get on because they can't urinate, or they get up at night and have to urinate 5 or 6 times a night. So they take a drug such as Flomax, and what that does is open up all the vessels in your system as well as your urethra so you can urinate better. And when you go to get up quickly, the blood vessels in your head drop, the blood drops to the floor into your lower extremities, excuse me, and you get orthostatic hypotension and you feel like you're going to pass out. That's because those blood vessels contain oxygen. And when that oxygen drops to your toes, guess what? It doesn't oxygenate your brain. So your brain is looking for that oxygen, and so many times when you start taking that medication, or sometimes some blood pressure medications, you end up feeling like you're going to pass out, and that's why. So you need to get up slowly. There's quick screening tools such as the Timed Up and Go test. The patient goes to get out of the chair and walk 10 feet, return to the chair and sit down again. Older patients who take 12 seconds or longer to complete that test may be at a higher risk of fall. So what you do is you get up, out of the chair, walk 10 feet, and then return to the chair and sit down again. And if that takes more than 10 seconds, you probably are at a higher risk for falling. So you need to have your doctor check for meds that contribute to falls, and that's part of our job now, especially through Partnership Health. Reevaluate the need for opiates, antipsychotics, benzodiazepines, non-benzodiazepines such as muscle relaxants, serotonin reuptake inhibitors. There are some that are more sedating than others. Sertraline, which is Zoloft, is one of the most sedating. And second-generation antihistamines like chlortrimeton, which we always used to take, and Benadryl, which we always used to take. And now we're going to loratadine, which is Claritin, because it's non-sedating. So there is a whole list. There's pages of drugs that elderly patients have trouble taking and may have a great risk for falling. So other ways to reduce the fall risk is to regularly exercise, rising slowly, good lighting, using grab bars, removing throw rugs. A lot of people taking vitamin E, 800 or 1,000 units a day, may reduce the fall risk by improving bone, muscle, and nerve health. Boy, we're just talking about a lot of things that can affect your life, and unfortunately, if falling isn't part of the aging process, the medications we take while we're in the aging process certainly add to that. We know that a lot of people, when because the standard of practice is to take medications, experts agree that high blood pressure and high cholesterol increase the risk of having a heart attack. So you might think that they agree on when you should take drugs to control them, but they don't. Earlier this year, the American College of Physicians issued more lenient guidelines for blood pressure in people 60 and older. They don't need drugs until their systolic or upper blood pressure goes above 150. It used to say 140, but the American Heart Association still says 140. And last year, the Preventative Service Task Force suggested that people who don't have particularly high cholesterol levels can still benefit from cholesterol-lowering statins but there are just too many groups issuing recommendations, and taking drugs when they aren't needed can pose problems. Side effects of blood pressure medication, ACE inhibitors, for example, the one that lisinopril and Acupril and those type of medications we take that have the lowest amount of side effects can cause persistent coughing. Some of them cause diarrhea, some of them cause nausea and dizziness. And statins can cause muscle weakness and possibly kidney failure and type 2 diabetes. So we're going to take a break, and then we're going to focus on your overall risk and let you decide, along with your physician, on whether or not you need to take some of this medication. Springtime. The sun shines, the bees buzz, and for millions of Americans, it's time to lock all the windows, blast the air conditioner, and hope that wonderful air filled with pollen never makes its way indoors. Hi, I'm Bill Kearney, pharmacist and owner of Northlake Medical Pharmacy. According to a national survey, 80% of the people interviewed said their allergy symptoms disrupt their lives. There's no reason to let allergies disrupt your life, and there are many preventatives and treatment options. Pollen probably won't kill you, but asthmatics and people with compromised respiratory systems are warned to take precautions when pollen counts are high. So over-the-counter remedies provide adequate relief for many sufferers, and most prescribed antihistamines will provide the same degree of effectiveness. So if you're suffering from seasonal allergies, stop by Northlake Medical Pharmacy and talk to our knowledgeable staff about your allergy symptoms. Find out what medication is right for you. Northlake Medical Pharmacies with 2 locations to serve you, at Hill Road next to Sutter Lakeside Hospital and outside Bruno's Shop Smart at 347 Lakeport Boulevard.
You've spent a lifetime making excuses to hide the fact that you struggle with your reading.
I'd read it, but I forgot my glasses. Oh, I don't need a menu. I'll just have whatever she's having.
I'll look it over later. I have a headache.
I just like getting my news from TV instead of the paper.
Oh, my eyes are too tired to make out print that small.
Just give me a landmark to look for. Who looks at street signs?
Oh, I don't need recipes for cooking.
I don't have time to fill this out right now. Can I take it home?
If you're tired of making excuses, there is help. Your public library offers a free one-on-one tutoring program specifically targeted to your reading level. You'll meet weekly with a tutor at a place and time that's convenient for both of you. To get help with your reading or to volunteer as a tutor, contact your local library. Call 888-767-7323. That's 888-SOS-READ. Or visit libraryliteracy.org. Don't hide any longer.
Sherman Gillums Jr., Paralyzed Veterans of America.
For more than 70 years, Paralyzed Veterans of America has helped hundreds of thousands of veterans get all the benefits they have earned.
Al Kovac Jr., Paralyzed Veterans of America.
We provide one-on-one support tailored to your individual needs, including healthcare advocacy, benefit support, and career assistance.
For more information, call 1-800-424-8200 or visit pva.org. A public service of Paralyzed Veterans of America.
This may sound like a typical high school basketball game being played on a Friday night in California. In fact, it's a crash course in cooperation and teamwork. It's a test of dedication, determination, and drive. It's character development in action. If you think high school sports are only about competition, think about this. High school sports can play a critical role in a student's overall education. In fact, studies show that students who participate in school sports are more likely to enjoy greater levels of achievement in their academic lives. At the same time, playing sports helps teach lessons not covered in the classroom. Lessons like tolerance, respect for the rules, and the importance of supporting your community. High school sports, a winning part of a complete education. This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
All right, we're back.
We are back, and we were talking about whether or not you need cholesterol medication, and though blood pressure and cholesterol levels are important, there's other factors that play a role too, including your age and gender and race and whether you smoke or have diabetes. And Paul and I off the air were talking about people taking
Let's kill that right there.
People that have ADHD, kids taking methylphenidate or stimulant drugs to cure their ADHD, and they're not having any hunger, and then you decide if they don't want to eat, who's the advantage for? Is it for the teacher and the parents, or is it for the child? And although most children don't have that side effect, other people do. Other children do, and it's something that you need to look at and just not accept if you're getting different results than what you planned on having. Same thing if you're an adult. Say everyone over 40 and over should probably know their overall risk of having a heart attack or a stroke. So experts are trying to estimate your 10-year risk by using a calculator developed by the American College of Cardiology and the American Heart Association. The ideal is a 10-year risk that's 7.5% or less. If your 10-year risk is greater than 10%, or your LDL, which is your bad cholesterol, is over 190, you should start taking a statin. But if your risk is between 7.5 and 10, it can be worth trying lifestyle changes first. Now, this isn't anything new, and I'm sure you're tired of me telling you this, but in I would say 90% of the cases that people are taking cholesterol medications, their lifestyle, diet and exercise could probably help them tremendously. That means stopping smoking, that means losing excess weight, that means being active, consuming a heart-healthy diet, drinking alcohol in moderation only, getting blood sugar levels under control. If that doesn't lower your risk enough after 3 to 6 months, then consider a statin, even if your LDL cholesterol isn't elevated. The same strategy applies to blood pressure. It's moderately elevated, meaning 150 to 160 for people that are over 60, 140 to 150. For others, consider drugs only if several months of diet and lifestyle changes aren't enough. Simple formula. And as drugs continue to escalate and formularies continue to decrease, lifestyle changes can add a great amount to your lifespan, can slash your risk of heart attack, and in some cases eliminate and reduce your need for medication. So regular exercise can lower your systolic pressure by up to 9 points. Every 11 pounds of excess weight can reduce it by 2.5 to 10 points. And then avoid excess sodium. Anything beyond 2,400 milligrams a day can lower it between 2 and 8 points in some people. And statins are thought to work not only by lowering LDL, but by stabilizing plaque deposits, making the deposit less likely to rupture. And that's by the anti-inflammatory effect. So people with history of heart attack or stroke, you're at a very high risk, greater than 20%. Should start with a higher dose of potent statin, 40 to 80 milligrams. Recently we've talked about people who've had a heart attack being discharged from the hospital with 80 milligrams of atorvastatin or Lipitor, or 40 milligrams of Crestor or the generic. Other people may start with lower doses of those of other statins, which is lovastatin, pravastatin, simvastatin. We use several different kinds of drugs to lower blood pressure, and for people with levels above 150, it can take a combination. Still, it usually makes sense to start with the oldest, safest, and least expensive. And I've talked many times about how a diuretic or water pill works. It puts excess pressure around the blood vessel, and when it puts excess pressure around the blood vessel, it pressuring against those walls makes the diameter of the blood vessel smaller. So if you get that fluid out of the body that's condensing the diameter of that blood vessel, it has the heart not work as hard. So if that doesn't work, you may need to switch or add an ACE inhibitor or a calcium channel blocker. Lots of names of drugs that you won't be familiar with unless you end up being somebody that has those kind of conditions. But just remember, the number one effective way to cure high cholesterol and high blood pressure, unless it's an organic thing that had happened to you, you were born with genetically, that's going to work for you better than anything is diet and exercise. Now, to those 10 super important questions to ask before you take medication and the reason why. Taking prescription medications is a serious business, an expensive business, and it's often tempting to play doctor and ignore the dosage instructions, and you may wonder why some of the instructions are the way they are. We've talked for many, many years, milk can interfere with some antibiotics like tetracycline. You may want to avoid bananas and other high potassium foods if you're taking what we call an ACE inhibitor, which we just talked about, because they will cause you to have more potassium in your system. If you're taking meds for high blood pressure or diuretics for excess fluid, eating foods high in potassium can increase the risk of irregular heartbeat or palpitations. Other well-known interactions include grapefruit juice with statins. We've told you many times, not just statins, but other medications now. Some of the antibiotics, Viagra also, overloading with vitamin K or cranberries with blood thinners such as warfarin. The grapefruit juice, the reason we tell you about that and statins is because it can cause the statin to accumulate in your system and overkeep that drug, so it elevates at higher amounts than you were normally had in your system because it doesn't expel it as frequently, and that's why you have to be careful with certain drugs with grapefruit juice. Another one we take, and I think probably the most ignored, is, can I have a glass of wine when I'm taking medications? And then we start analyzing, well, I only have one glass of wine a day. And drinking alcohol when you don't take med changes life's things in your body. There's a buzz factor, there's drowsiness, there's possible hangovers, there's changes in your blood sugar. It will increase the instance of side effects with certain meds. For example, you can become very drowsy if you sip wine and take allergy meds. If you take a serotonin reuptake inhibitor for depression, tyramine, which is found in many alcoholic beverages as a result of the fermentation process. Many times you can take a glass of wine and at Thanksgiving time with your turkey, and all of a sudden you have a liver replacement. Now, listen, this are extreme cases, but you don't know how many times I have prescribed or dispensed oxycodone or hydrocodone, and I've told people not to drink with it, and the alcohol on their breath when they come in to pick it up is staggering. So if you're taking meds such as antibiotics or antipsychotics, and that's for like Abilify and Seroquel, and a lot of those medications that affect the way that you think. Antifungals, which you wouldn't think would be a problem for a fungal infection. An oral medication can cause nausea, stomach cramps, vomiting, flushing, and headaches. You just don't realize how extensive the addition of alcohol can make to those systems. And that's why you see so many celebrities that die of heroin or narcotic poisoning. It's not just, it's a cocktail of things. It's the medication, it's the alcohol, it's heroin, probably introduced at the same time, and they may or may not have been in rehab, and when they were in rehab, before they went in rehab, they were taking these toxic doses and they build up a resistance to them. Now they've been in rehab, they've not been taking it, they go back and fall off the wagon and they go back to the same dose they had, and it ends up killing them. This is one that people don't ask me very often, but it's one that's happened to me and happened to other people. And if you throw up, should you take another dose or wait? Well, you need to know when you took the meds. If you vomit within 15 minutes of taking your medication, you should probably take another dose because it hasn't really gotten in your system and been digested. It has to break up into what we call a metabolite, and then it has to get into your bloodstream. So that takes more than an hour or two. So your meds have probably already passed into your stomach if you wait for an hour or two, so you can wait till your next dose to take it. But if you have taken it within 15 minutes and you throw up, and most people do, and I would say within a half an hour, then you probably need to take another dose. Now, if you keep throwing up and this is the first time you've taken the medication, you probably shouldn't be taking that medication. Now, then you look at the label and say, did the label say take it with food and I didn't take it with food? Then you need to take it with food and try again. If those meds are giving you tummy trouble, you may want to try foods to help soothe that tummy ache, because lots of times the side effects of those medications are from a GI upset. How long will it take you to feel the effects of the medication? We hear this all the time, especially with pain medications. When you're sick and tired of being sick and you want relief, but feeling better may take longer depending on your condition and medication. A lot of these medications travel straight from your digestive system to your bloodstream, while others have to get through the liver first. So it will typically reach your bloodstream no later than 8 hours after you've ingested it, but some cases it will reach peak levels in only 30 minutes. So if you're taking a time-release medications, those are designed to dissolve slowly in your system, and you should feel the effects from that medication within the first 6 to 8 hours, but it might take sustained ingestion to make a significant difference in your condition. Now we're talking about things like antibiotics. You know, an antibiotic has to take, or an antiviral has to take effect by building up an immunization against the virus or the bacteria in your bloodstream. And that happens gradually over a period of time. And even though it may start reacting after 6 to 8 hours, your body hasn't built up enough resistance through taking that medication to be effective maybe for a couple of days. A lot of people who take a Z-Pak because they take 2 as their first dose think in 24 hours they're going to be better. Now, I don't have any objections to people thinking that, because mentally has a lot to do with whether or not these medications are effective or not. So if you feel a definite difference, then certainly take advantage of that opportunity, but don't think that you're cured just because it's working all of a sudden. Another question, especially as the cost of drugs escalates, is can I crush my pills to make them easier to swallow? And it's not just kids who hate to swallow pills. Some adults find the process of or prospect of swallowing a pill overwhelming, and they just can't do it. It's okay to crush the pill and mix it with applesauce or pudding if it is not a time-release medication. But that's a no-no with medications that are slow dissolving or have time-release coatings that could lead to an overdose of the medication or irritate your stomach lining. And I've had people all the time ask me whether or not they could crush pills or not. There are even some tablets that are scored where you can cut them in two and give yourself half the dose, and but not crush them because they're too irritating to your stomach. Potassium is one of those. I would be very careful about ever taking a capsule, although we've had people take capsules and open them up and put them in pudding or applesauce and ingest the whole thing, and that's been effective because all of those little pellets in that capsule are designed to dissolve at a certain rate. If you don't crush them, that will occur in a solid substance such as pudding or Jell-O or something, applesauce. But if you start to crush them, we've had to make up some kinds of esophageal reflux drugs that have like Prevacid, that has little teeny capsules in it, and dissolve them and crush them so a pediatric patient could take it. It takes a long time to do that, and it's not the most effective way, but it is effective at getting it into the system if there's no other choice. Probably the most important of all of these questions is, do I have to take the full course of meds? You've heard us say take all the antibiotic until it's gone. No matter how good you feel, we want you to finish this medication. As you've listened to me in the last few weeks, you've heard me say that necessarily isn't the way it's going to go in the future. They may find out that taking antibiotics for 3 or 5 days is just as effective as taking it for 10 days, if in fact you evaluate the disease that you're taking it for. But if it's a long-term disease that requires, 5 or 10 days, after 5 days you may feel better, but you may have the tendency to relapse for that medication. So always ask your doctor or your pharmacist how long you need to take this. Normally, if you only need to take it for 5 days, the physician will write the prescription for 5 days. We've had people write a prescription for pain medication for 25 pills and says take 1-3 times a day for 10 days. In that situation, it doesn't mean you got less pills. It means for up to 10 days. If you don't need it, and as we've talked about in the last few weeks, states are limiting how much pain medication they're dispensing. Some states it's 7 days. Some states in Connecticut, I think it's 7 days. In Ohio, it's 5 days worth of pain medication, and they can't write prescriptions for more than that. So we've had physicians lately, and then the patient wonders why I didn't get 30 pills, and we'll tell them the physician only wrote for 25. So they probably shouldn't have put 10 days, but that was meant as an absolute last time you should take it. So if you're taking meds to relieve pain and the pain goes away, you can probably stop taking those pills. I've had people that have had hip surgeries and knee surgeries that said, I don't want any pain medication. I don't want to get addicted. More so with hip replacements than with knee replacements, because the knee is a functioning part that moves extreme amounts of how often you move it and how far you move it for a period of time, and that becomes a lot more painful. If you're taking an antibiotic for an infection, stick with the course unless the doctor tells you differently. There may be residual bacteria holding on despite that much of an antibiotic to multiply should the medication be stopped too soon. So that's why it's important to always ask your doctor or pharmacist how long you should take it. It's going to take a while for the standard of practice to change, like we're expecting, so they don't write for as many antibiotics as they did. Right now, if you go into my sister, who is 77 years old, went in with a severe cough. This is back in the Midwest, and she wanted her doctor to write a prescription. The doctor did all the tests and said, this isn't a bacteria, it's a virus. It will do me no good to prescribe an antibiotic for you, and they don't. And more of you are experiencing that as you go to your physicians with an illness now. And we used to ask for an antibiotic. That's not nearly as prevalent. So when you ask for a pain medication or you ask for an antibiotic, there's going to be questions. If you're over 65 and you ask for a drug that is going to slow you down and maybe help you sleep, they're going to be asking you questions, because we are required to interfere with that process when it goes through the PBM, the Pharmacy Benefit Manager, and insurance company. A lot of you take herbs and supplements, and these are things that have been used for 100 years, but if you listen to my radio show in the last couple of weeks, you know that there's some dangers in taking over-the-counter alternative medications, especially when they're mixed with prescription meds. You'll hear a program in the future of when somebody took an IV of turmeric And turmeric is something that we take as an anti-inflammatory, and taking it as an IV ended up terminating somebody's life. So some vitamins and herbs can interact with your certain medications. You know, we used to tell you to take medications over the counter as an antidepressant, and many times those reacted with your thyroid medication, reacted with your digitalis. Even though they were over the counter, they had side effects that affected the way your other medications work. The list is so long for interactions with alternative meds that, excuse me, it's essential that you tell your doctor everything you're taking, even if it's all natural. When I do a brown bag check, I ask people to bring in all their medications. And I've told you many times, any of you, no matter where you get your prescriptions, can come in, be very honest with me, bring in everything you take, including aspirin, ibuprofen, whatever it is, and I will tell you if there's any drug interactions or if you have any duplicates on the medication that you're taking. We have interaction checks on our computer, so we can put everything in there, and herbs or vitamins will, if they will conflict with your medication, we will tell you so. And along with taking antibiotics, you'll see physicians ask you to take a probiotic many times with your antibiotic. And if you've had troublesome side effects taking antibiotics like bloating or constipation, diarrhea, a yeast infection, you know how miserable that can be. And those symptoms on top of everything else becomes a little overwhelming. So when taking antibiotics, higher doses of probiotics are needed because the makeup of the bacteria in your gut is competing against that good bacteria. So as antibiotics kill off some of the good bacteria, then more of the bad bacteria can take hold. I had a patient in last week. I went out on the floor, and she was getting an antibiotic, a strong antibiotic filled for her grandson. And the doctor told her to get a probiotic, and I found a probiotic that was generic. You only took one a day. Excuse me, and it wasn't expensive. And I told her not to confuse taking the medication 4 times a day with taking the probiotic once a day. But a lot of people do that on their own. And especially with antibiotics, they're uncomfortable in your stomach. Clindamycin is one of those that can cause diarrhea and cause some problems. Cephalexin for some people, which is a super form of penicillin, can also do that. Certainly sulfa drugs like Scepter or Bactrim DS can certainly cause a problem like that also. So, and back to antibiotics, when you get a medication and it says take it twice a day, does that mean morning and bedtime, or does it mean every 12 hours? Even in hospitals, twice a day is breakfast and dinner time. If your label directs you to take the meds 3 times a day, that's morning, afternoon, and evening. It never hurts to be more precise. The antibiotic is going to be more effective if you do it exactly on time, but we're talking about compliance here. And many times people won't take it if they have to do it every 8 hours, every 6 hours around the clock, or every 12 hours. They will forget to take some of those doses. So if you do it at mealtime, breakfast, lunch, and dinner, if it's 3 times a day, if it's twice a day, at breakfast and dinner, if it's 4 times a day, breakfast, lunch, dinner, and bedtime, again, that's not the perfect way to take them. But if you're worrying about being compliant, that's what you need to do. The last one that we get requests for, not nearly as often as we did, but will a generic drug be as effective as a name brand? And paying outrageous money for name brands or having the insurance make your copay so ridiculous is, there may be differences in the way the pill is constructed, and that may lead to some individual variations. For the majority, there won't be any problem. There are specific instances when a brand name product is best, but that is very, very small. So 99%, it used to be the thyroids and the seizure medications we would not dispense generically, and the heart medications, Today, they have to be within 3%, plus or minus. That means the bioavailability in your system has to be within 3% of the brand name, or they're not approved. So we've given you an awful lot of information today to digest, and I hope it's been helpful information, because this complex world of healthcare is continuing to get out of hand, and we're looking for shortcuts, and we wonder if the shortcuts are the right thing to do and will be just as healthy. But when you end up paying $3,000 or $4,000 for a medication for a month's supply, that becomes, or putting your house up because you're on chemotherapy, there has to be some alternatives. And a lot of those alternatives are coming through the insurance companies and the drug manufacturers, and there will be more and more pressure on people to observe those things. We want to remind you that we're still doing immunizations. We're still doing Zostavax, tetanus. You're going to be out there cutting stuff down with the spring. You're going to get poison oak and poison ivy, and we want to take care of you there. We still deliver to Kelseyville, Upper Lake, Nice, Lucerne, Buckingham, Lakeport. Just give us a call a day ahead of time, and we'll have your medication out to you. Remember independent business. Remember to take care of the local people who take care of your community. Remember, when you walk in the door and we say hi to you, that's a very meaningful thing from us, because we care about you. It's very hard in today's society to compete with companies that don't support us. So we support the community. We want the community to survive. We want our businesses to survive, and we want you to survive. And you are the most important commodity that we have, and we want to continue doing that. So we want to remind you that we're there for you at 2 locations across from Sutter Lakeside Hospital. I just asked somebody the other day, they said, how long have you been there? I was down at a meeting in Santa Rosa, and I said 38 years. And they wanted a credit check from somebody through a co-op, and wanted to know how long I'd lived in my house, and I said 35 years. And if that isn't a dedication to this community, I guess there really isn't one. So I want you to remember those questions that I told you to ask your pharmacist or physician when you get a new medication. Those are important to how well you're going to be. And also those questions about your high blood pressure. Do you need to take all those medications? And when you are taking a statin, all of a sudden your muscles tense up and you don't know what's wrong, it's very possibly the cause of that medication. We can change that by either giving you a different kind or changing the kind of statin you're on. And maybe you don't even need to be on that medication if you do what we ask you to and have a diet and exercise and take that, not a shortcut, but a shortcut in saving money for your future. So how are we on time, Paul?
We're just about to play the music here in about 2 seconds. 1 and
2. Well, I want to remind you, we're North Lake Medical Pharmacy with 2 locations for you. At 5136 Hill Road East, across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Call us there at 263-1328. Thank you, Paul. Stay dry.
Oh, yeah, and we'll see everybody back here again next Wednesday for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.